This is the last of 8 video blogs on health and wellness. We've already gone over the whole process of health coaching, and we've indicated that you could do your own health coaching, or you could get someone to help you. Sometimes we get stuck and we need some extra help. I'm going to review what we've done so far, and that is you've started to think about a wellness philosophy. You've gone over your health history to really get an idea of where you are now, where you've been, and where you want to go in terms of having a healthier life. You've come up with a vision where you want to be in about 3 months, 6 months, a year, and set short-term and long-term goals. Figuring out your confidence level, whether you really think you can meet those goals, and what the barriers are. Sometimes the barriers can be environmental, social, physical, and even mental. Once we start to learn how to set goals that are realistic, specific, measurable, attainable, and timely, then we can move forward. Then we see results. Once we're getting results, we want to maintain or continue the activity in our lives and keep changing and modifying the goals as we meet one goal and move on to another one. So we can constantly be on a forward moving path. I just wanted to touch base on this last video, why we're doing this. The main point is that if we do something about our health, we can be 70% effective in improving our lifespan and the quality of our life, how we feel, how we look, how much energy we have. 20% of the outcomes on our health and wellness is related to genetic factors, and 10% is related to what we don't do. And that could be either A, we don't smoke, we don't drink, or B, it could be we do things like we don't exercise. So we can have negative or additional positive effects by either don't doing something or doing something. A lot of us don't realize that one of the highest risks for women is not breast cancer, but heart disease. Other risks are things like diabetes. Of course, we do have to worry about things like different types of cancer, whether it's breast or colon cancer, or for men, prostate cancer. There could be other types of disease processes like autoimmune problems, which could involve things like rheumatoid arthritis. So there's a lot of things that can happen to us, and those things creep up on us over time. But as I said before, you can do something about it. They've also found that people who neglect their health could end up suffering for 15 years before they pass away. If a person takes care of their health, then it could be possible that you may not suffer much at all, like maybe a year before you pass away. Plus, if you're taking care of yourself, you can keep doing fun stuff, like being with your kids or grandkids, playing golf, tennis, pickleball, staying engaged in a community, being active, being mentally astute and active. One of the biggest problems is sugar consumption, and that can lead to heart disease and diabetes and many other diseases like cancer. Why? Because sugar helps to cause inflammation in the body. So the main point of all of this is to learn ways to manage what we call either the onset or prevent the progression of chronic disease. And unfortunately, chronic diseases cost a lot. They cost you, your family, and your friends your presence and your vitality. They also cost you in terms of your pocketbook if you end up having to go to the hospital. An average hospital stay is about $20,000. That's for a short one. And many people end up having to pay $250,000 for a very severe onset and period of time in the hospital. So the best thing to do is to really think about prevention and realize that the cost of prevention is way cheaper than actually having to go to the hospital. So if you spend some money on your gym membership or supplements or the medications you're supposed to be taking, if you spend money on a personal trainer, a health coach, perhaps maybe a nutritionist or even a mental health counselor, exercise classes, even though you're spending money, you're going to, in the long term, save money. The results are going to be very beneficial for you. And think about having someone help you, someone to support you to get to where you want to go.